Dear DHOs and MCH in charges, we have found a new problem. You know, the health system is very dynamic and it's a complex entity. The in-charges of the health facilities do not know even what is in their store. They tell the midwives this is not available when actually some of these commodities are available. They are uncomfortable experiences that you find there is no BP machine on the maternity ward for monitoring of mothers or for taking BPs, but there are more than 5 BP machines in the stores. I have personally seen this in more than 3 districts. The stores have BP machines, the stores have thermometers, but on the wards they are not there. So I want to encourage you and implore you that get interested, be in charge. There's a very bad word that they use, the opposite of not being in charge. That if you're not in charge, then you're in discharge. I don't know if that is correct, Dr. Senyon. But that is not where we want to go. We want to see that in-charges are in charge. DHOs renew in-chargeship on an annual basis. If someone is not working, throw them out. Dr. Edward, they are our new word Mogole. If an in-charge is not in charge, please don't renew their contract. Submit to COW and get them out. Leadership is going to be the cornerstone of the transformation that we want to achieve. Masaka is shining because of the sacrifice of this gentleman called Senyon. And we support you. Let's clap for him. The midwives are shining because they have leadership. You can see when they are talking with confidence. At the national level, we want to do our part. We want the regional referral to do their part. And Dr. Senyon is an exemplar. Of course, there are other consultants who are doing extremely well. And I'm also happy about the director and deputy director. Director attends those Masaka meetings. I listen to him. Very good interest. We are not doing anyone a favor. We are doing our job well. Me coming here, I'm not doing you a favor. This is my work. Going to the lower facilities and the whichever places we are going to, we are doing our work and we want to do it well. If you're DHO and you're not supervising, then you're not doing your work well. And I will not single out my specific colleagues, but do your work well. You have an opportunity. We are holding public offices because of a reason. It's not that we are probably the most qualified. There may even be more qualified people than us. But we are in these positions for a reason, and we need to fulfill that mandate. So, Ministry of Health is happy about the progress that you are making, and we pledge to continue with the journey of supporting you at different levels. Of course, our major role here is to provide the leadership and coordination, which we pledge to continue doing, to mobilize resources. You've heard my friend Edward was asking for an upgrade of a health facility. Of course, the director is asking for beds for the MCH complex, and you're probably the first regional referral to receive an MCH complex. Oimas is coming up. You can clap for that. Government can never forget Masaka. But also you being an exemplar, always Masaka, the good plannings, the leadership, the exemplary work is always the Greater Masaka area. Of course, you have some challenges, like the ones over the island. And thank you for the coordination through the call center and the other ambulance network. Director, I've already submitted. Me, when I'm there on WhatsApp, I'm working. I've already brought to the attention of the Commissioner for the AIDS Control Program the issue of rising HIV cases. That one is already sorted. I brought to the attention the issue of equipment and the ICU and HDU to the Commissioner for Infrastructure, and I think Dr. Dan knows where the money is. So most likely we shall get some of that equipment. Most likely. So Masaka will be shining.